Good afternoon, everyone. My name is Sawan. I'm a PhD student from the School of Computing and Information System in the University of Melbourne. On behalf of our research team, I'm going to present our research study about system complexity in the adoption of VR irresolute AI facilities. This is the agenda of my presentation. Let's start with some background information. Recently, VR has been adopted in resident care for enrichment purposes. We use the term enrichment to mean experience that provide other people with opportunities to engage in activities that support their emotional and social connection needs. VR is appealing to all those to resident care because it brings the outside world into the confined environment of the care home, enabling people to engage in activities that they can no longer easily do in the real world, such as global travel or underwater discovery. Residential care facilities are complex environments involving residents with complex conditions, especially dementia. According to the statistics from the Department of Health, over 50% of residents are suffer from dementia. So it is crucial that emerging technology are carefully designed and deployed to foster benefits for this population. So identify challenges and opportunities in the adoption of VR industrial capabilities may have the implementation achieve greater likelihood of success. In fact, technologies with organization are socio-technical. That means that uh, they influence and are influenced by the social setting in which they are used and need to be responsive to the usability issues of users. Therefore, introducing VR technology in this setting may face complex challenges. So this research aims to evaluate complexity brought about by the adoption of VR in resident care for enrichment purpose. This research is expected to contribute to information system, human-computer interaction, and gerontology by providing an evidence base of system complexity involving social technical challenges related to VR adoption in resident care facilities. With this objective, we have conducted a comprehensive literature review regarding two aspects: the use of VR among adults and technology-based innovation in resident care. In terms of the use of VR among adults, the literature indicates that VR experience benefit adults' emotions. For example, helping them happier, providing more fun, helping them escape from depressions. A common concern regarding VR use among adults is the potential to experience discomfort. Because of time limited for presentation, we I won't explain more detail about this issue. So for more information, please have a look at our full paper. In terms of the adoption of technology-based innovation in retinal care, literature shows that there are some challenges such as diversity of residents, resistance from residents and staff members. Similarly, because of time limiting, please have a look at our full paper for more detail about these issues. This issue also can be grouped as several themes, such as residence-related issues, technology-related issues, staff-related issues, external-related issues, resident-related issues, organization-related issues, etc. This indicates the relevance of using NAS framework to examine the complexity brought about by this adoption. So the NAS framework proposed by Greenhouse et al. Is utilized to examine the socio-technical complexity brought about by this adoption. The NAS framework, the NAS stands for Non-Adoption Abandonment Scale-up Spread and Sustainability. The framework is proposed for those seeking to design, develop, implement, scale-up, spread, and sustain technology-based programs in healthcare organizations to identify the key socio-technical challenges of technology adoption. According to Greenhouse et al., adoption of technologies in health and care settings may be influenced by the complexity across seven domains: condition, technology, value proposition, the system, healthcare organization, weather system, and continuous embedding and adaptation over time. Each domain is suggested to be classified as simple, complicated, or complex. According to Greenhow et al., the domain which is straightforward, predictable, and has few components is classified as simple. A domain which involves multiple interacting components or issues is classified as complicated. A domain which is dynamic and predictable is classified as complex. Greenhow et al. Conclude that technologies in which multiple domains are complicated have proven difficult to implement, and those with multiple complex domains are less likely to become mainstream. Drawing on the research objective and the NAS framework, we propose following research questions to investigate what complexity exists in the seven domain brought about by the adoption of VR technology in rational capacity. To answer these research questions, we conducted a survey study which is designed based on the NAS framework, incorporating with the issues identified in the literature review. Our research participants are rational facility staffs who are involved in the VR program, and data collected will be subjected to descriptive analysis. By adopting the NAS framework incorporated with this issue, the issue identified in the literature review, we decided a set of questions to explore socio-technical complexity brought about by the VR program. For example, in the adopter domain, Greenhow also suggests to explore adopter-related issues. Adopters in this program include staff members and residents. However, because residents have complex conditions, challenges raised from residents are included in the condition domain. So in the adopter domain, we explore staff-related issues. Meanwhile, the literature indicates that staff may not have skills for facilitating the program. Staff may resist technology adoption. Staff might need to take more training regarding VR use. So we decided these questions for exploring complexity of this domain. In other domains, questions are proposed in similar ways. These are initial findings from the surveys. To date, there have been initial 10 responses. The survey is taking place during COVID-19 lockdown decade. So 10 responses, quite encouraging to our team. The graph shows detail of the number of respondents with their level of agreement with the statement. For example, regarding question 9, results indicate that staff may actually not have enough capacity to facilitate VR program. These two respondents strongly disagree, 1 disagree, and 3 unsure. Only 4 agree that staff have enough skill. In terms of question 10, staff are generally open to adopting VR. Half of respondents agree and another half disagree or unsure. This means that staff may not to open adopting VR programs, so this issue needs to be further investigated. When it comes to question 11, staff are recommended to take more training regarding VR use. As the graph shows, nobody disagree or strongly disagree with this statement. This table shows the complexity of several domains after analyzing survey responses. The complexity of condition domain and the technology domain is classified as complex because the challenges of this domain are dynamic and unpredictable. These challenges are to some extent caused by usability issues of the technology. The complexity of the adopter domain and the system domain is clearly classified as complicated due to multiple interacting components potentially involved. The complexity of the value proposition domain and the organization domain is classified as simple, since most respondents acknowledge the value that VR technology bringing for IKEA residents and not many organization-related challenges have been raised. Back to Greenhow et al. Statement, technology that involve complicated challenges, complicated domains are challenges to implement. Technologies that involve multiple complex domains are less likely to be sustained. Thus, from this table, we predict that the VR program is significantly challenging to be sustained within the rational environment. However, results will be further analyzed and findings will be confirmed when more data are collected. From this study, Some issues should be further investigated. For example, why and how frequently residents experience discomfort, why some residents disagree that VR is suitable for a care resident, why some respondents perceive that VR activities are high risk, etc. So that's the opportunity for future work. This is the reference that we refer to. That's all for our presentation today. Thank you very much.